This is the interview with Dr. Crippen, April 2nd, 2008, at the CDC in Atlanta. And I guess we'll just start with, if you just do an introduction, who you are, how you became involved with public health and smallpox, and why you became involved with it.
Okay. First of all, it's Mr. Crippen.
Mr. Crippen, okay.
And who I am is a public health advisor. So that's for those of us who are public health advisors, that says a lot. I was right now. I'm still with CDC. I've been with for more than 40 years. I was in the Peace Corps in Thailand right out of college, right out of bachelor's degree, and didn't have anything to do with public health. I was a teacher, but when it became time to come home, I needed a job, and there were a lot of postings that came through for Peace Corps volunteers who were about to return, and most of them were teaching jobs, and I wasn't interested in a teaching job. And the only other one that seemed interesting was being what we used to call a VD investigator. And so that sounded interesting to me. And I applied for it, and I was interviewed and got the job. It was very easy at that time, frankly. If you had a bachelor's degree in almost anything whatsoever, they would hire you, and you could walk. You could get a job as what became public health advisors. At that time, we were not public health advisors. We were what were called cooperative employees, which meant that they could fire us at will for the first year or so. But after a year, we became public health advisors. I started out in Chicago and then went to Detroit. And when I was in Detroit, there was opportunities to go to West Africa for the smallpox program, which interested me a great deal from my Peace Corps experience. I hadn't been to Africa, but I knew what it was like to work in a third world country, if you will, and it sounded fascinating. So I applied for that, and I was selected, and went to Nigeria, what had just recently been Biafra. The war was over, but had just recently over. And that would have been in 1970. And we stayed there for 2 years in the eastern part of Nigeria, in Calabar and Enugu. Enugu was the capital of Biafra at one time. And I saw a lot of interesting things. I saw monkeypox, for instance, which was misdiagnosed as smallpox at the beginning. But what I did not see in 1970 was smallpox. There wasn't any in 1970 in Nigeria. And we looked very hard. We didn't know that there wasn't any. Everybody assumed that it was mostly gone, but people wanted to be sure that it was really gone. So we looked very hard, and we found monkeypox. We did some good things. It was combined with a measles control program, and we did a lot of measles vaccination. It saved, I think, a lot of children's lives with measles vaccine. But I didn't see any smallpox, which kind of nagged at me. So we came back after a few years, 1972, went back to Chicago, at this time with the immunization program. And things, routines went on, had children, things like that, like people do. And then heard about the opportunity to go to Bangladesh. And so I threw my name in the ring again for a temporary duty assignment to Bangladesh. And I was selected. I think I was the first public health advisor to go to Bangladesh. Before that, I think it was all physicians who were there. Immediately following me was Gene Roy. I don't know if you've interviewed him yet, but I'm sure you will if you haven't. But he I think, was the second public health advisor in Bangladesh. So we flew over on the plane to New Delhi with Mike Lane, who, if you haven't interviewed, I'm sure you will. And we stayed in New Delhi for a couple of days, had dinner at Bill Foegge's house. And then I got on and Mike Lane stayed in India. He was working in India. I got on the plane to go to Dhaka, and arrived sick as a dog in Dhaka. Interviewed with Nick Ward, who is a British epidemiologist who's very famous in smallpox circles, and I worked with him again in WHO in Alexandria, the Eastern Mediterranean Regional Office, a few years down the road. We were working on diarrhea and acute respiratory infections. But in any case, Nick Ward was there in Bangladesh. Stan Foster was essentially, Nick and Stan, I'm not sure who was on top, but they were, Stan was certainly the American in charge, although I think Nick might have been overall in charge of the WHO project. And the other person of note was Stan Music, who later on, established some of the field epidemiology training programs at CDC. And Stan Music gave me some medical advice, which is basically drink a lot of water and get some sleep and feel better in the morning. Here's some aspirin. And eventually I did feel better. A couple of days later, I was out in the field. And at that time, we spent, I think it was 20 days in the field straight, and then 5 days back in Dhaka. So they just put me in a Land Rover, and off we went out to my station, which was Faridpur. Nothing much to recommend Faridpur to anybody. It's by road, by Land Rover, it was about 4 hours from Dhaka. It was a long drive, not very far as the crow flies, but it took a long time to get there. And met the team, and I thought I knew what I was supposed to do. I'd been briefed anyway what I was supposed to do. I was supposed to find smallpox, go out with the team and search and follow up rumors and vaccinate around the cases that we find. Do forward tracing, and that was the big thing at that time. Not to look back to where it had come from, but to look forward as to where the disease might have gone. Find the close contacts and see where they may have gone, and then go to that place and see if anything had happened there. And it didn't take long for me to see my first case of smallpox in Bangladesh. I think that first trip out, I saw my first case, and she was dead. And I remember the man, a woman about, I don't know, a young woman, 18, 19, something like that. And we said, we heard there was smallpox here, and he said yes. And I said, is there anybody here with smallpox? He said, yes, here. And he pulls back a blanket, and there's this corpse of this young woman there. And it certainly looked like smallpox to me. Finally, I had seen my first case. I was hoping it would not be a dead case, the first one that I saw, but there she was. And that was the beginning. We saw many cases after that. Thankfully, many of them still alive. That was. It became clear that it's not real easy to catch smallpox, you really have to be in the same house with somebody who has it, and close within the same hut, and sleeping in the same place, eating in the same place, living in the same place, and then it's relatively easy to catch it. But outside of that kind of close environment, I at least didn't see much transmission in marketplaces or buses or things like that, or casual contact. So I stayed there not quite 3 months, more than 2 months, less than 3. I was there from January 1974 to, I think, early March of 74, and then came back to routine in Chicago, going around to Catholic schools and making sure everybody had their shots. That was my job. So it was the way I got into it was a fascination with working overseas, and which has never left me. I've stayed in it one way or another since that time, and the public health aspect is certainly rewarding. I mean, you see fewer bodies when you left than there were when you arrived. So that's one way of measuring success.
What was your first thought when you arrived in Bangladesh?
Well, it was not real different from some things that I had seen in Southeast Asia. But I guess my first thoughts were that I was too sick to do anything. But I was glad that you know, I knew Stan, and so I felt things would probably be all right as long as Stan was around there, you know, giving me some advice. When I was back in Dhaka out of the field, I stayed at Stan's house. So he was, you know, it was kind of a. And of course, he had his whole family there. He had all his kids and his wife, and, you know. So it was a nice way to you know, to be in the field with essentially nothing, you know, and then to come back, you know, and be in a family atmosphere before you went out again. I was trying to think before coming, how, you know, right now we communicate all the time. You know, people have BlackBerries and cell phones and everything, and I can't remember that we communicated at all, you know, when we were in the field. We were there, that's it, and nobody essentially knew where we were. And I don't remember getting instructions from anybody or inquiries from anybody. You know, we just did what we did. We kept records of things that we were supposed to keep, and we came back, and during those 5 days, we shared what had happened. But in between, there was nothing. There was no contact whatsoever that I can remember. One time we were in well, most of Bangladesh is water, water with a little bit of ground in between, and that's the way the people make their living, is fishing and rice. But in any case, we would take the Land Rover to Faridpur town, and then from there usually go by speedboat someplace, named or unnamed. And then get out of the boat and walk, and you would walk for hours to wherever it was you were going, to some small village where there was a rumor of something happening. So the boat was very important. The Land Rover less important, and walking was extremely important because that was the only way you got to where you were going. But I remember one time we were in the boat, and our driver. Wasn't the best, I guess, a boat driver. Anyway, he hit another boat, and we all, me and the team member that was with me, anyway, out of the boat, fell out of the boat from the crash. This is the Ganges, a tributary of the Ganges, and I lost my glasses, and I lost, you know, my wallet was wet and all that stuff. But and the team member that was with me, he broke his arm. I didn't break anything, but I lost my glasses. I had sunglasses with me, so but that kind of thing, you know, if it were to happen now someplace, I mean, there'd be all kinds of, you know, of support and running back and getting things repaired, and there was nothing. I mean, you just put on your sunglasses and keep on going until you're back in Bangladesh, back in Dhaka. I mean, where you can get something repaired and get something done. I think now that I think about it, it's pretty amazing that there weren't more injuries than there were, or weren't things happened that you know, that couldn't be retrieved. Maybe there were, or maybe you'll find out about them, but I never heard about them, and we just seemed to do it, you know.
How old were you?
Well, that was 1972. No, 74. So I was born in 1942. So what is that? 34? Yeah. What's 42 from 74? Whatever that is. That's how old I was. I wasn't a kid, but I had my second son had just been born in September of 73. So he was, you know, he was less than 6 months old when I went, and my wife was not thrilled, although she understood. I mean, she had been with me in Nigeria, and so I think she understood that the call of the pox or whatever. I don't know.
What would you say was the most frustrating part of your job while you were there?
My favorite what?
The most frustrating part.
The most frustrating part? Ah, boy. I guess part of it was interference, but there wasn't a lot of it, but there was some. The person in charge of that area under the British system is called a civil surgeon, and he was it was a little unusual. He was, of course, they were all Bengali. That was the ethnic group, and they should have all been Muslim because of the partition in 1947, and that's why Bangladesh had been East Pakistan, and then in 1971 became Bangladesh. Well, this was 1974, so it was it wasn't that long that they'd been independent. And they were still using the British system, and the civil surgeon was a Hindu. For everybody I worked with was Muslim. But he was a very high-class, kind of self-important person, as some people tend to be. And there were, of course, goods that came in, to support the program, among which were motorcycles that came in to be used by the teams for going around searching things. And he sort of appropriated one for his son, and I took it as part of my responsibility to disappropriate it, But it was clear that you can't offend this man, because I mean he controls everything. He controls the petrol that you use in the Land Rover. He controls all of the personnel that are on your team. I mean, you can't do anything without him. So we just had a little conversation, and I just had to let him know that I was aware of the fact that there should have been 20 and there's only 19 motorcycles, and his son just happens to have a new motorcycle. And that that this would be embarrassing if it became well known, and surely he understood that within a month or so after the newness of war had worn off that we might be able to use his son's motorcycle for what it was intended for. So it's sort of a veiled threat, if you will, of embarrassment. Nobody likes to be embarrassed like that. So we got it back eventually. But that kind of thing can be frustrating, because I mean, you can't. You have to be what? You can't be quite as upfront as you might like to be, or as Americans are used to being about some things, and you have to work within the culture as it stands, and within the personalities that you're confronted with. So, that's not. I guess it's not really frustrating. It's part of the job. It's what you learn how to do. If you want to get things done.
So between the time that you left for Bangladesh and the time you came back, how do you think that you changed as a person and as a public health worker?
Well, in terms of public health, I think I learned how to get along in another environment. I had been in other environments before, but each new place you go to teaches you something. Specifically for Bangladesh, I'm not real sure, but it certainly enforces or reinforces your ability to be flexible, and to take things as they come, and to work within the constraints that you're given, and to just try to do the best you can with what you're given, and keep on going. So that those skills, I think, are valuable wherever you happen to work. As a person, I'm not really sure how it changed me. I'm sure it must have. I guess it perhaps made me more resilient than I had been. I don't think I was any smarter, I think I knew how to bounce back better. Anyway.
How many other assignments overseas have you had?
Oh, gee, a lot. In terms of temporary duties, after that, I was with yellow fever in Gambia with Tom Monath and others. I did something again with Nick Ward in Indonesia for WHO for looking at at their immunization program in Indonesia, and then again we went both to Indonesia and to Bangkok to look at that. But then I was with WHO for 6.5 years in the Alexandria office, which is now in Cairo, as I said, for diarrheal disease and acute respiratory infections. And then I went from that office to Hanoi for HIV/AIDS and spent a year and a half in Hanoi. And then came back to CDC and went to the Western Pacific for 3 years, the 6 U.S. jurisdictions in the Western Pacific, 3 countries and 3 territories. Came back to headquarters and was at the Global AIDS Program, and went to I don't know how many countries in Southeast Asia and West Africa, South Africa, and Central America, Brazil. And now I'm with the Emerging Infections Program, and with them I've been to China and to Kenya. And so once you get the bug, you sort of keep it, I guess. And if you know of any other opportunities, I'm ready. So, keep moving.
Any words of advice you'd like to give?
I guess you just, I mean, my only advice would be that CDC needs to keep doing this sort of thing and needs to keep up its reputation as a world leader in global health. There's people around the world, as you know, Dr. Sencer. I mean, you came to, when I was in Alexandria, you came as a consultant to was it Yemen or Qatar or someplace anyway, because I don't remember which country it was, but they wanted somebody to come who could give them advice about their public health system. Well, that sort of thing happens all the time. Sometimes it's high-level advice like that, or it's very nitty-gritty. What do we do now? This is a disaster, and the world looks to CDC to be able to provide that kind of expertise. And the only way you develop that kind of expertise is by doing it, by continuing to do it, and having your personnel used to performing the job in an odd place with little or no assistance. So. Okay.
Thank you, Peter.
You're very welcome. Thanks.
Okay.